Hi, welcome to today's podcast where we will explore how communities are coming together to support children's mental health across North Carolina. My name is Angel Moore, and I'm the Director of Practice Support at Eastern AHEC, and I'm also your host for today's podcast. Today, we're talking about NC-PAL, a program that's quietly revolutionizing how children get help for mental health needs. Whether you're a doctor, a parent, a teacher, or just someone who cares about young people, this is the episode for you. So what exactly is NC-PAL? Why does it matter so much? And how can you help spread awareness about it? Let's find out from our guest today, Paige Fuqua. Paige is a practice support coach at Eastern AHEC, and through a very special partnership between NC-AHEC and NC-PAL, Paige also serves as the NC-PAL resource coordinator on our Eastern AHEC practice support team. So, Paige, welcome.
Thank you.
Thank you. Let's dive right on in and ask Paige important questions about NC-PAL. Can you explain to our listeners what NC-PAL stands for, what the acronym stands for, and why it was created?
Sure. NC-PAL stands for North Carolina Psychiatry Access Line, and it is an actual telephone line that pediatric providers can call when they might have maybe complex cases involving children, adolescents, maybe have a patient with depression, anxiety, ADHD, and don't always have the time or the tools to manage complex cases like that. So this supports them. And, especially in rural areas where some resources are scarce.
Oh, wonderful. It sounds like an actual lifeline, like a telephone line that serves as a lifeline for providers who are the first point of contact. Can you give an example of when or why a provider might use or access the psychiatry access line?
So a pediatric provider might call in and say, I have a 14-year-old with severe anxiety. Maybe the patient's not responding to medication or having some side effects. And so they can access a psychiatrist at NC-PAL who can help with medication management. It's fast, it's supportive, and it's evidence-based.
Oh, wonderful. Can you walk us through the logistics of the line, what number to call, what happens when someone picks up?
Sure. The line, they call the phone line. It's 919-681-2909. They press 1 for pediatrics. Behavioral health consultant will answer the phone, gathered some information, caller's name, practice, reason for the call. If the primary reason for the calls is to find resources in the area local to the caller, the behavioral health consultant can usually manage those calls. But if it's, a call related more to diagnostic or medication management, they'll be connected with a psychiatrist.
Wow, this sounds like a great resource. It sounds like it could be expensive. Is there a charge to use the line?
No, it is completely free for providers to call the line.
So there's no charge, and someone with expertise that is necessary on the other end of the line. So you talked a little bit about the access line in general, but are there other resources? Like what can that behavioral health coordinator what other things can they provide? Resources, tools, or is it just about diagnostic support?
The behavioral health consultant that answers the phone can help providers find appropriate resources in their area or in areas close that are related to the patient's needs.
Oh, wow. Sounds good. In terms of the logistics of the call, does it have to be the pediatrician or the provider? Can anyone from the practice call?
The initial call can be made from a nurse or a medical assistant, but any kind of follow-up consultation needs to be made by the provider,
Okay.
by the primary care provider.
Is there also like a limit to the number of times a provider can call?
No, they can call as many times as they need. And they can also, providers can call back the line if they need additional support for a patient that they've called about previously.
Oh, awesome. So we talked about NC-PAL, the access line, the tools that a provider can get from the line. Is there anything else you want to share? Anything new, exciting about the line?
Well, right now the psychiatry line is only for pediatrics and perinatal patients.
Okay.
But another line is in the works for adults with mental health and or substance use disorders that they'll be able to call. So that's coming soon.
Oh, wonderful. That is definitely needed as well.
Yeah.
As we come to a close, talking with this episode, is there anything that you want to share with our listeners and explaining to them how maybe they can help spread the word about NC-PAL? I know we want to make sure it's utilized and make sure that everyone out there knows about this resource that is at no charge.
Okay. Yeah. Providers can enroll in NC-PAL by going to the NC-PAL website. There's a button, enroll now, and they can go ahead and enter their information. Now, that's not required to make the first call. It just saves some time because they're already in the system and the behavioral health consultant can pull up that information. And then the provider is enrolling themselves, not the entire practice. So it is, provider level enrollment. They can also, after they use the line, it's really helpful if they complete the survey that is emailed to them. So it, helps make sure that, we can make improvements if needed. And so they can do that and just really help spread the word among other providers about that the line exists to use it.
Awesome. Thank you, Paige. Thank you for joining us today and talking to us about NC-PAL. You may see Paige out in the community performing or doing outreach, informing practices about NC-PAL and the resources available to them. So again, thank you, Paige.
Thank you for having me.
No problem. So as we've heard today, again, just to summarize, NC-PAL is not just a phone line, but it's also a bridge. It's a bridge to connect providers, empower families, and most importantly, ensures that children in North Carolina get the help that they need when they need it. Again, thank you for joining us today. And please remember to all our listeners out there to share information about this access line. Once again, the North Carolina Psychiatry Access Line is available Monday through Friday, 8 a.m. to 5 p.m. at 919-681-2909. I do not have that memorized like Paige, like Paige does. But again, thank you for listening to our podcast, this episode today. If you found this episode helpful, please share it and subscribe wherever you get your podcasts. Thanks for joining us.
Are you looking for trusted, up-to-date information on clinical research? Visit clinicaltrials.gov, your gateway to thousands of clinical studies happening around the world. Whether you're a healthcare professional, researcher, or patient, you'll find detailed information on study purpose, eligibility, locations, and results, all in one place. It's free and easy to search, and backed by the United States National Library of Medicine. Empower your decisions with real data. Did I mention it was free? Explore clinicaltrials.gov today. That's clinicaltrials.gov today.